everyone and welcome to Mount Miriam Cancer Hospital. If you have followed through our video as we spoke about pre-chemotherapy care, today we are going to talk about post-chemotherapy care. As chemotherapy actually is an individual experience which each cancer patient experience chemotherapy differently, could be emotionally or physically. So today again we have staff nurse Leonie and staff nurse Deepa to share with us what are the post-chemotherapy.
So each person experiences the side effects from chemotherapy differently, and different chemotherapy drugs also cause different side effects as well.
Normally, what advice would you give to our patient after chemotherapy?
So let's start with eating and drinking. It is recommended that the patient on chemotherapy eat high protein diet and also avoid raw and or spicy foods. Drink more water than usual for about 2 days. This helps to move the drug through the body. And as for your toileting needs, I would recommend that you use a separate toilet from your other family members if at all possible. Otherwise, double flush the toilet after using it. And also rest once you go home for after chemo, as the chemotherapy may be tiring to you. And also avoid infections as well as crowds. Otherwise, continue your daily routine as usual.
Is there any long-term care that a patient should be aware of within a week or longer?
Usually on the 7th to 12th day of the chemo, your WBC will become low, so the immune system also will become as low, where you can easily get infected. So do avoid infection and crowded places, and come for regular follow-up according to the appointment date given, even all your chemo has been completed. Do not take any vaccination during the chemo without consulting oncologists. Different chemo have different side effects. To speak with your oncologist regarding the side effects if having specific complaints.
In general, we heard of patients getting side effects after chemotherapy. What are the most common side effects that should a patient take note of, and what should they do?
Alright. Take note that some of the side effects of chemotherapy only happens while you're having treatment and disappear quickly after the treatment is complete. But others can linger for months or years, or may never even completely go away. So, however, please don't panic. Not all chemotherapy has all the side effects that we are going to mention later, right? In fact, some chemotherapy may only have 1 or 2 of the side effects that we are going to speak about in a moment. So, one of the more immediate side effects that one may suffer during chemo is what we commonly call an allergic reaction. This is sometimes we call it a hypersensitivity or anaphylactic reaction. This is pretty much immediate and fast. So the reaction that occur might present as shortness of breath, redness or rashes on the skin, flushing of the face, and also swelling of the eyes as well as the lips. So if you feel any of the above mentioned signs and symptoms, please do give us a call immediately or come to the hospital. We will medicate.
Okay, one of the more common side effects of the chemotherapy is nausea, vomiting. Generally, your oncologist will provide with post-medication to bring home and may include antiemetic. Antiemetic means vomit medication. Try to take the medication 15 to 30 minutes before meal. Another way to deal with it is take small amount of food frequently. If unable to take normal meal, you can replace with nutritional drink. What we are having in Mount Miriam is ensure, peppermint, glucena, resource drink, sapotan, and more. But if the nausea vomiting is persistent, visit your oncologist immediately.
So when people hear chemo, quite often they think no hair. Well, nowadays not all chemos causes hair loss, but those that do will cause hair loss in about 1 week after the first chemotherapy. But you do not go bald immediately. This happens gradually. But the process in between might be messy. The hair might be all over the house, all over the place. So I do have some patients that during the process of losing their hair, they just shave it all, keep it clean. That's each individual's freedom to do so if they wish. Otherwise, wearing scarves, wigs, hats, or even just go plain bald is not a problem. However, please remember, if you plan to do any eyebrow embroidery, do it before any chemo starts.
The major effect of chemotherapy is blood disorder. This included low red blood cell count, low white blood cell count, and low platelets. For low blood count, usually the patient will be presented with fatigue, tiredness, and shortness of breath. This can be treated with blood transfusion or iron supplement.
And due to low white blood cell count, so a patient will be at increased risk for infection due to the poor count. So avoid crowded places such as the malls, cinemas, where it's easy to spread infection. However, that doesn't mean that you will have to be trapped at home. You can still come out to the malls, to the cinemas. It's just that choose a time when there's less people, such as the working hours during the weekday. And also avoid other people who are sick. This includes babies and children. So also avoid gardening, as there are many germs in the soil as well as the plants. Avoid pets as well for the same reason. So no raw food. Do not leave food or drinks exposed in the room temperature for long hours, as bacteria may grow. And also maintain good personal hygiene. And if you have any temperature, fever of more than 38 degrees Celsius, please do give us a call or come to the hospital. A subcut injection to boost the body's production of the white blood cell may also be given, which is what we usually call the subcut filgrastim. So one of the side effects of this particular medication is bone pain, body aches, due to the massive production of white blood cells. In this case, sometimes the doctor will order a prophylactic pain medication for you to control this body pain.
For low platelets, the usual symptoms shows as bruising and bleeding. Use soft toothbrush to prevent gum bleeding. Avoid contact sports that may cause physical injuries such as football, basketball, and etc. Platelet transfusion may be given if required. Consult with your oncologist if you are on any blood thinning medication. Go to hospital immediately if there is any active bleeding that can't stop.
Constipation may also occur. So it may be due to the common side effect of the chemo, or it could also be a side effect from other medications such as painkillers. So eat a high fiber diet if possible, and also laxatives also may be given if you haven't been able to pass any motion for 2 or 3 days, or if all else fails, an enema can also be given. And on the flip side, some may experience diarrhea instead of constipation.
If you are having diarrhea, anti-diarrhea medication can be taken as prescribed. On 4 occasions, please inform your oncologist. First, unexplained diarrhea times 4 or more than that per day. Second is diarrhea with no oral intake to replace what you was lost. And third is diarrhea with fever. And the fourth is persistent diarrhea even after taking the medication. There is actually many causes of diarrhea. So investigation need to be done before effective treatment can be given.
Chemotherapy destroys rapidly dividing cells. Unfortunately, the mucous membrane in our mouth and throat, as well as the entire gastrointestinal tract, falls under the category of rapidly dividing cells as well. So sores or ulcers will easily develop in the mouth and throat, so causing discomfort when swallowing. So we call these sores and ulcers as mucositis generally. So it may sometimes be so severe that the entire mouth and throat is covered with ulcers, and sometimes it may even bleed. So brush your teeth with a soft toothbrush and maintain good oral hygiene. And then rinse your mouth 3 or 4 times a day with a solution of 1 teaspoon of baking soda, which we usually call sodium bicarbonate, and 1 teaspoon of salt diluted in 1 cup of lukewarm water. So most commercial mouthwashes tend to have alcohol. So please refer to your oncologist for recommendation of mouthwashes that are not irritating. So eat soft foods and drink more fluids. Avoid foods that may irritate the mucous membrane, such as oily food or spicy food. So sometimes the mucositis may be so severe that your intake is so poor that you start losing weight. In which case, sometimes the doctor may recommend that you have a tube inserted, which we call a nasogastric tube, which is a tube inserted through the nose that will go directly to the stomach. In that case, we will be feeding nutritional drinks through the tube.
Some chemos causes skin problem. Normally changes in color of the skin and nail is quite common. Usually darken or have freckles. Some chemo causes nail to become as brittle so that it becomes easy to break. So protect your hands by using a glove when washing the dish. Avoid direct sunlight for the certain chemo by using umbrella, long sleeve and long pants. Do not wear tight shoes that may apply pressure to your nail beds. Use lotion to keep your skin moist.
As for nerve and muscle problems, are also one of the side effects of certain chemos, not all, but it causes what we call a neuropathy, which is the dysfunction of the nerves. So the most common symptoms that you will notice are tingling sensation, burning sensation, also numbness or pain at the affected areas. Also, there might be also a loss of balance or position. So the most commonly affected areas tend to be the extremities, like the tips of the fingers, the tips of the toes and your feet. So I would advise not to wear tight socks or shoes, as it can worsen the pain and tingling and may lead to sores that cannot heal because you do not know that you have any wounds at your feet due to the numbness. So wear soft, loose cotton socks and padded shoes, as well as soft clothing. Do some passive exercise to improve circulation and also stimulate the nerves.
Okay, many chemos affect kidney and some the bladder. Normally the patients will be having signs and symptoms like decrease in urine output, bleeding and pain. This part of reason why the blood test will be done prior for chemo. It is to check the kidney function for any abnormalities. Drink more water. Sometimes the doctor may order for extra IV fluids during the chemo to avoid holding bladder. If you notice blood in the urine, to inform immediately. Sometimes urine color may be orange or red due to the chemo coloring, so that that is not a blood. So the nurse usually will inform prior to give such chemo.
Some chemo may cause infertility, so speak to your oncologist about it before starting chemo. not after. So regardless if you are male or female, I repeat again, it's generally advisable to plan for a child at least 6 months after completion of chemo. Well, as for females, the menstrual cycle may become irregular or stop altogether during chemo treatment. And sometimes, in some cases, it might even cause early menopause.
Certain chemo drugs can damage the heart. So if you are on this drug, you may sometimes feel palpitation, irregular pulse rate, sometimes can cause sweating also. If all these, to see doctor. It may even be heart attack. Usually the oncologist will check your heart function by doing ECG or echo if the plan is to give you any cardiotoxic drug.
Treatment for cancer, including some types of chemotherapy, can cause lung problems. So such condition may be fibrosis, pneumonitis, pneumonia. So generally the presentation is shortness of breath, persistent cough. It's quite a general one. So we strongly discourage smoking. Okay? So also do not go for scuba diving unless the lung specialist has said that it is safe to do so. Take medications as prescribed if there's any, such as the puffs and such. And if O2 supplementation for breathing is required, you may need to prepare some oxygen at home. So ask your healthcare provider for more information if necessary.
Another important thing that a patient should know is extravasation, where there happens leakage of chemo from IV line into the surrounding tissue. During chemo, patients should observe for any redness or pain at the cannulation site. If the pain is increased or persistent, to inform nurses or doctor immediately. Some chemos may have some late effects where everything was absolutely normal when patient is going back time, but once at home in few days they have noticed redness, blister and ulcer at the injection site. Come back to hospital immediately. Don't hesitate to call us or your oncologist if you notice any of the symptoms stated. Early detection and treatment are the best way to control your symptoms. Also, do not be panicked by all the side effects we mentioned just now. We are just discussing in general the more common side effect of chemo.
Yeah, that's true. So this does not mean that one course of chemo will give you all of the side effects that we mentioned just now. So do not panic. Usually only a few of the side effects may occur, and this is also different for each individual, even if they are on the same chemo. So the severity is also different for each individual.
What should a patient or a patient relative prepare prior to calling healthcare provider?
Normally the hospital phone number will be on the appointment card. So when calling us, patient they have to prepare with patient name, IC number or hospital registration number, and inform patient current condition. If they need ambulance service, to give their contact numbers and address too.
Thank you, Staff Nurse Leonie and Staff Nurse Deepa, for sharing with us the general side effects after chemotherapy. So again, chemotherapy is essential treatment for a cancer patient. However, all the side effects may differ from one patient to the other. So again, once again, thank you so much, Staff Nurse Leonie and Staff Nurse Deepa. So thank you very much for joining us.